Did you know that in the United States, 1 in 8 women will face breast cancer at some point in their lives? In 2024 alone, the National Breast Cancer Foundation estimates that more than 300,000 women and about 2,800 men will be diagnosed with invasive breast cancer. So, how can you avoid becoming part of that statistic? The key is early detection. When breast cancer is found in its early stages, treatment is usually more effective and survival rates rise sharply. In this video, we will walk you through 10 warning signs and symptoms of breast cancer that you should never ignore. But first, let us quickly explain what breast cancer is and what raises your risk. Breast cancer usually starts in the milk ducts or the milk-producing glands of the breast. As abnormal cells grow, they can invade nearby breast tissue and form a noticeable lump. If the disease is not treated, those cells can spread to the lymph nodes and then to other parts of the body. This spread is called metastasis. Several factors can increase your chances of developing breast cancer. Age is one of the strongest risks, with rates rising sharply after 50. Family history also plays a role. Having a close relative with breast cancer increases your risk. Hormonal factors such as starting periods at a young age or reaching menopause later in life can add to that risk. Lifestyle habits matter too. Drinking alcohol, smoking, being overweight, and not staying physically active all make breast cancer more likely. Exposure to radiation and certain inherited gene mutations, such as changes in the BRCA1 or BRCA2 genes, can raise the risk even further. Breast cancer in men is rare, accounting for less than 1% of cases in the United States, with a lifetime risk of about 1 in 726. It is most often diagnosed between ages 60 and 70, with the average age around 67. Unfortunately, it tends to be more deadly in men because they are less likely to suspect that a lump could be cancer and may not even realize men can get breast cancer at all. This often leads to diagnosis and treatment much later than it should. That is why it is so important for both women and men to pay close attention to early warning signs. With that in mind, let us move into the 10 breast cancer symptoms that could save your life if you recognize them in time. Number 10, changes in breast size. Changes in breast size may seem minor at first, but they can be an important early sign of breast cancer that many people overlook. Imagine noticing one day that one breast looks a bit fuller or larger than the other. It is easy to shrug it off and assume it is due to hormones, your menstrual cycle, or even the way you slept the night before. But when that difference does not fade or gradually becomes more obvious, it deserves your full attention. Breast cancer can alter breast size because of a growing tumor inside the breast tissue. Under normal conditions, breast cells grow and divide in an orderly way. Cancer cells, however, multiply without control. Over time, this uncontrolled growth can create a lump or mass that changes the overall volume and contour of the breast, making it appear larger, swollen, or misshapen compared to the other side. If you notice a persistent change in the size of one or both breasts, especially if it is new, unexplained, or accompanied by other changes, like skin dimpling, nipple changes, or a palpable lump, you should not ignore it. Make an appointment with a healthcare professional for a detailed examination and, if needed, imaging tests. Early evaluation is crucial for ruling out or detecting breast cancer when treatment is most effective. Number 9, changes in the skin's texture. Breast cancer begins when abnormal cells in the breast grow out of control and form a tumor. As this tumor enlarges, it can start to affect the tissue around it, including the skin that covers the breast. One of the visible results of this process is a change in the skin's texture. You might notice dimpling, puckering, or an appearance similar to an orange peel, where the skin looks slightly thickened with tiny pits or indentations. This happens because the growing tumor can attach to and pull on the surrounding connective tissue inside the breast. That inward pulling creates tension beneath the surface, which then causes the skin to dimple or wrinkle in certain areas. In some cases, cancer cells can also spread into the lymphatic vessels within the breast. When these vessels are blocked, lymph fluid can build up, leading to swelling and inflammation. This fluid accumulation further alters how the skin looks and feels, making it appear uneven, tight, or slightly swollen. Performing regular, careful breast self-examinations gives you the best chance of noticing subtle changes in skin texture early. If you spot new dimpling, puckering, or an orange peel, like a surface that does not go away, it is important to have it checked promptly by a healthcare professional. Early attention to these changes can play a crucial role in detecting breast cancer at a more treatable stage. Number 8. Itching or irritation. Itching or irritation in the breast often seems harmless at first. You might blame it on a new bra, a different laundry detergent, or dry skin. But when that itch does not go away, keeps returning to the same spot, or is accompanied by other breast changes, it could be signaling something more serious. Breast cancer does not always start with a lump, and in some cases, persistent itching or irritation can be one of its early, easily overlooked warnings. This symptom can be especially important in the case of inflammatory breast cancer, or IBC, a rare but aggressive form of breast cancer. Unlike many other types, IBC usually does not cause a distinct, easily felt lump. Instead, it tends to show up as noticeable changes in the skin and tissue of the breast. The itch or irritation may feel deep, persistent, and not relieved by typical remedies like moisturizers or changing fabrics. The underlying problem often involves cancer cells blocking the lymph vessels in the skin of the breast. When these tiny drainage channels are obstructed, lymph fluid cannot move properly. This buildup of fluid leads to redness, swelling, warmth, and sometimes an orange peel-like texture, along with that nagging itch or burning sensation. If you notice ongoing itching or irritation in one breast, especially if it is paired with redness, swelling, warmth, or skin changes, do not just assume it is an allergy or minor rash. It is important to have a healthcare professional examine the area. Early evaluation can help rule out serious causes or catch inflammatory breast cancer at a stage when treatment has a better chance of success. Number 7. A marble-like hardened area under your skin. A small marble-like hardened spot beneath the skin can be a quiet but serious warning sign of breast cancer. Because it may not hurt or cause obvious discomfort, at first many people overlook it until it becomes larger or easier to feel. This kind of firm area often reflects a developing tumor within the breast tissue. As the tumor grows, it can change the internal structure of the breast, leading to hard, distinct lumps that feel different from the surrounding tissue. These lumps are usually irregular in shape and can be felt as solid, well-defined masses under the skin. Unlike many benign or harmless lumps that tend to feel smooth and move slightly when pressed, cancerous lumps are typically firm, fixed in place, and do not glide easily under your fingers. The difference comes from how the cells behave. Normal cells grow and divide in an orderly, controlled way. Cancer cells multiply without regulation, creating a dense mass inside the breast that can alter both its size and its shape. If you ever feel a new hard, unmoving lump or a marble-like area in your breast, especially if it is only on one side or slowly getting larger, it is essential to have it checked by a healthcare professional as soon as possible. Early evaluation can help distinguish between benign changes and something more serious. Number 6. Breast or nipple pain. Breast or nipple pain related to breast cancer usually feels different from the temporary soreness many people experience around their menstrual cycle or due to minor irritation. In cancer, the discomfort is often persistent and focused in one area rather than coming and going. This type of pain can develop as a tumor enlarges and presses on nearby tissues and nerves. The constant pressure inside the breast may cause ongoing aching, stabbing, or burning sensations sometimes, along with swelling skin changes or visible distortion of the breast. The intensity of the pain can vary from mild to quite noticeable, and it may become more obvious when you lie in certain positions, lift your arm, or engage in specific activities. Some breast cancers, including inflammatory breast cancer, are especially likely to cause pain. Inflammatory breast cancer is an aggressive form of the disease that often makes the breast look red, swollen, and warm to the touch. Cancer cells in this condition can block the lymphatic vessels in the breast, trapping fluid and causing significant inflammation. That buildup of fluid and pressure is a major reason for the discomfort and tenderness many patients feel. Before we move on to the next important warning sign, We would really appreciate your support. If you find this information useful and want to keep learning more health tips and awareness topics, please give this video a like and subscribe to our channel. Be sure to tap the notification bell so you will be alerted whenever we share a new update that could help protect your health. Number 5, swelling in all or part of the breast. Swelling in the breast, whether it affects the entire breast or just one area, is something that should never be ignored. Even if you do not feel a distinct lump, swelling alone can sometimes be a sign of breast cancer. As cancer develops, abnormal cells within the breast tissue begin to grow and multiply. This uncontrolled growth can trigger inflammation in the surrounding tissue, which in turn leads to visible or palpable swelling. This swelling may involve the whole breast or only a specific region, and a lump may or may not be noticeable on self-examination. In some cases, the breast may also appear red, feel warmer than usual, or look slightly distorted or different in shape compared to the other side. Any new persistent swelling, even without a clearly defined lump, warrants a visit to a healthcare professional for proper evaluation and, if needed, imaging tests. Early assessment can help identify whether these changes are due to cancer or another condition. Number 4, nipple retraction. Nipple retraction might seem like a small or temporary change at first. You may suspect it is related to breastfeeding, minor trauma, or simple aging. However, when a nipple that normally points outward starts to turn inward and stay that way, it can be a warning sign of an underlying breast problem, including breast cancer. Nipple retraction is often associated with invasive ductal carcinoma, the most common form of breast cancer. As a tumor develops in or near the milk ducts behind the nipple, it can pull on those ducts and the surrounding tissues. Over time, this inward pulling effect can cause the nipple to gradually retract or appear flattened. On a microscopic level, multiplying cancer cells invade nearby breast tissue, leading to inflammation and the formation of scar tissue. This scarring tightens and tugs on the structures attached to the nipple, drawing it inward. At first, the change may be very subtle and easy to overlook, but as the tumor grows, the retraction becomes more obvious. If you notice that one nipple that used to look normal has become inverted, newly pulled in, or is changing shape over time, especially if this is new, and only on one side, it is important to take it seriously. Do not assume it is a harmless change. Make an appointment with a healthcare professional for a thorough breast exam and appropriate testing so any serious cause, including breast cancer, can be detected as early as possible. Number 3, red, dry, flaky, or thickened skin on the nipple or breast. Imagine looking in the mirror and realizing that the skin on your breast or around your nipple looks different than usual. It may appear unusually red, dry, rough, or flaky. In some cases, the skin can even feel thicker, tougher, or slightly hardened. While it might be easy to assume this is just irritation from clothing weather or a skin condition, these changes can sometimes signal an underlying breast cancer. These skin changes often occur when cancer cells begin to grow in the ducts or lobules of the breast. As these abnormal cells multiply, they irritate and inflame the surrounding tissue, leading to visible changes on the surface. You might notice redness, dryness, peeling, scaling, or a thicker, almost leathery texture. Some people also experience itching, a burning sensation, or tenderness in the affected area, making the skin feel especially uncomfortable or sensitive. Another way breast cancer can cause skin changes is by blocking the lymphatic vessels in the breast. These tiny channels normally help drain fluid from the breast tissue. When cancer cells invade and obstruct them, fluid can build up under the skin. This extra fluid can make the skin look swollen, tight, or altered in texture, further contributing to redness, thickening, and other unusual changes. If you see persistent redness, flaking, thickening, or irritation of the breast or nipple skin, especially if it is only on one side and does not improve with basic skin care, it is important to have it checked by a healthcare professional. Early evaluation can help distinguish between harmless skin conditions and possible signs of breast cancer. Number 2, nipple discharge that is not breast milk. Nipple discharge refers to any fluid that comes out of the nipple when you are not breastfeeding. While some types of discharge can be benign, it can also be a warning sign of breast cancer, especially when it appears unexpectedly or comes from only one breast. In breast cancer, Rapidly growing abnormal cells in the breast tissue can form a tumor that interferes with the normal function of the milk ducts. As this tumor develops, it may cause fluid blood or pus to leak from the nipple, acting as a visible alarm that something may be wrong. This discharge can look very different from person to person. The color may be clear, milky yellow, greenish, or mixed with blood, giving it a pink or red tinge. The texture can also vary. Some discharges are thin and watery, while other types are thicker, sticky, or more mucus-like. It may occur spontaneously without squeezing the nipple or only when the area is pressed. Often nipple discharge linked to breast cancer does not appear alone. It may be accompanied by other worrisome signs such as a new lump in the breast, changes in breast-shaped skin, dimpling, crusting, or scaling around the nipple or nipple retraction. That is why it is so important to be familiar with what is normal for your body. To recognize nipple discharge as a potential warning sign, pay attention to any new or unexplained fluid coming from one or both nipples, especially if it is persistent bloody or associated with other changes in the breast. If you notice this, do not ignore it. Schedule an evaluation with a healthcare professional so the cause can be properly investigated and, if necessary, treated as early as possible. Number 1. Swollen lymph nodes under the arm or near the collarbone. Lymph nodes are small, bean-shaped structures that play a vital role in your immune system. They act like security checkpoints, filtering out germs, abnormal cells, and other harmful substances from the lymphatic fluid that circulates through your body. When everything is normal, you hardly notice them. But when breast cancer cells break away from the main tumor, they can travel through the lymphatic vessels and lodge in nearby lymph nodes, especially those in the armpit or around the collarbone. Once cancer cells reach these nodes, the nodes begin working overtime to fight what they recognize as a threat. This immune response, combined with the presence and growth of cancer cells inside the nodes, can interfere with the normal flow of lymph fluid. As a result, the lymph nodes can become swollen and sometimes tender. You might feel them as small, firm lumps under the skin, often accompanied by a sense of fullness, tightness, or pressure in the underarm, or just above the chest, near the collarbone. Swollen lymph nodes in these specific areas are particularly worrisome in people at risk for breast cancer because those nodes are directly involved in draining lymph fluid from the breast tissue. However, it is important to remember that not every enlarged lymph node means cancer. Infections, inflammation, and other conditions can also cause them to swell. The concern increases when swollen nodes appear together with other breast changes like lumps, skin, dimpling nipple changes, or persistent pain. In that case, the likelihood that they are related to breast cancer becomes higher, and they should be evaluated promptly. The encouraging part is that many people today survive breast cancer, especially when it is found early. Staying alert to signs like swollen lymph nodes, giving yourself regular breast checks, and seeking medical advice when you notice something new or unusual are powerful steps you can take. Early detection greatly improves treatment options and outcomes, helping doctors act before the disease has a chance to spread further. If you have watched this far, it already shows you care about your health and the health of the people you love. Remember, noticing a change does not mean you have breast cancer, but ignoring a change is never a safe option. Your body often whispers before it ever starts to shout. Paying attention to these early warning signs and talking to your doctor promptly can make the difference between catching breast cancer early or facing it much later when treatment is harder. If this video helped you understand breast cancer symptoms more clearly, please give it a thumbs up and subscribe to our channel. We create simple science-based health content, especially for people over 60 and their families. Turn on the notification bell so you never miss an important health update, and share this video with someone who might need this information today. Your one small action could help save another person's life.